Early last year, Tanzania incinerated at least 5,000 chicks it said was imported illegally and carried the risk of spreading bird flu. The move resulted in a diplomatic row between the two largest economies in the East African region. East African Community and other international stakeholders have identified cross-border disease outbreaks such as Ebola, Rift Valley fever, and foot-mouth as potential obstacle for intra-trade in the bloc.
We have planned a field simulation exercise, which basically is kind of like where we simulate in real life an outbreak of a disease. All of you have heard about diseases like Ebola, which are highly contagious, highly infectious, but also they are highly fatal. They kill many people.
The East African community is receiving support from the government of Germany through the organization called GIZ to build the capacity of the East African community to prepare for such health emergencies.
All the diagnostics and the equipment for the work on the farms and others with cash money. So all in all, I think it's a rule of thumb at $1 million for this simulation exercise.
The 1 million shillings from the German corporation GIZ will support frequent simulation exercise in which the experts will be carrying out fictitious disease outbreak management exercise across the region. EAC Senior Livestock Officer Dr. David Balikowa says Kenya and Tanzania still lack sufficient preparedness capacity when disease outbreaks strike and thus need to enhance capacity to boost the level of preparedness. In the cross-border simulation exercise, pandemic diseases experts say it is important to use a multi-sectoral approach as the inter-border diseases have a significant impact on tourism, agriculture and manufacturing. Stakeholders believe that cross-border simulation exercise on disease outbreaks could not have come at a better time, considering that the neighboring Democratic Republic of Congo is in the equation, with the country struggling to contain the Ebola peril.
The East African Community region borders the Democratic Republic of Congo, and currently we know that in DRC Congo there is an Ebola outbreak which is ongoing. Being the fact that we share borders and that there is free movement of people between our countries, the countries in the East African community are at high risk.
From time to time, disease outbreaks grab the headlines many times in Kenya, and preparedness is another thing. But for the first time, the East African community, the World Health Organization and other stakeholders have formulated a strategy that will ensure that Kenya and Tanzania are well prepared. Brian Itava in Namanga, Channel 1 News.